So here we will present the hyperglycemia as an independent risk factor in ROP. Actually, ma'am, there are many causes of ROP which we have studied. Hyperglycemia is one of them. But here, our main aim and objective is to determine whether hyperglycemia is linked to the ROP as an independent risk factor. So what we have done is have in the neonatal setup over a period of 12 months, we have enrolled the premature infants from below the 1500 gram and below 32 weeks of gestations, and we have collected the whole blood for the initial 7 days every 8 hours. For those which have blood glucose level less than 50 and more than 150, we have sent them for laboratory confirmation. For the all practical purpose, we have taken more than 150 as a limit as for definition of hyperglycemia. So what we have done by bivariate analysis, we have compared the hyperglycemia among hyperglycemia, and have compared between the two groups, the euglycemic group and the hyperglycemic group. And how of the group, we have seen that 48%, at least 48 patients has been identified as a hyperglycemia. 30 patients or 30 patients has been diagnosed of ROP, out of which 19 were in stage 1, 10 were in stage 2, and 1 were in stage 3. Of the 48 patients, 22 patients were from the hyperglycemic group by here, as we have compared, the p-value came as 0.07, which has been as significant. Here we have followed the retrospective regression model by which we have compared between the two groups, and we have neglected all the compounding factors. By logistic regression model, we have compared all the risk factors which are responsible for ROP, and we have found that this hyperglycemia is actually independent for other risk factor as an independent risk factor for ROP. Ma'am, we have compared with many other studies, and though many of the studies were all retrospective studies, here we have done a prospective cohort study, and we could, from the discussion, we could already tell that actually it is the premature babies and the initial hyperglycemia in the initial 7 days is actually as independent risk factor for developing for ROP. The limitations were there that it is a study-centric study. We had a very short duration and a small sample size, but the results were quite encouraging. Thank you, ma'am.